Breast cancer knows no gender, no age, no race.
It can affect any of us, and it touches all of us.
Our sisters, our mothers,
our daughters, our friends.
Us.
But research saves lives.
Research is the reason millions of breast cancer survivors are thriving today.
Join Lifetime to support the Breast Cancer Research Foundation. Together, let's stop breast cancer for life.
To be asked to be a part of the PSA from our sister network Lifetime, along with the stars of the movie Patsy and Loretta, Megan and Jesse. This is the 25th anniversary of Lifetime's annual Stop Breast Cancer for Life initiative, a commitment to supporting research, which is always so very key. And in case you haven't noticed, we're going pink. We're going pink right here on GMA, raising awareness about breast cancer, celebrating fighters and thrivers who are here. You see them holding up their signs that shows the years they have been thriving. 6 years.
6 years. 6 years.
Yeah. And you spent time with a very remarkable woman.
Yes, this is a story of a woman celebrating her 1 year. Jana Geyer is a thriver today because she became her own health advocate. She felt a lump in her breast, and despite being told, we've heard this story before, she was too young for a mammogram, she followed her instincts, and that saved her life.
Most of Jana Geyer's days are spent chasing around her daughter Ava. But in February 2018, her world came to a screeching halt.
I was saying goodbye to my husband. When I put my arms out, I noticed that I felt something in my right breast, and it happened to have been a lump.
Little did she know, this would mark the start of Jana's breast cancer journey at just 33 years old.
I was a picture of health. I have no family history. I'm not a smoker, and I'm not a drinker. So on paper, you would definitely not think that someone like me would have breast cancer.
Jana says she went to the doctor that day for a breast exam, who confirmed the palpable mass and said she needed an ultrasound and a mammogram. But when she called the hospital to make her appointments, she says they told her she was too young for the mammogram.
They said the ultrasound would suffice. And the radiologist had told me, based on the imaging, we believe this is a fluid-filled, benign breast cyst. And it's quite large, so we want you to keep an eye on it.
Relieved that it appeared to be benign, Jana says she moved on, and yet she still felt the lump. She says her doctors aspirated it twice and ran tests, but other symptoms like redness and swelling started to appear. 7 months after she first found that lump, she had the cyst surgically removed. Then she got a phone call.
I'll never forget that day, October 1st, 2018. The doctor told me, Jana, the results came in and it is positive for breast cancer.
Jana was diagnosed with invasive ductal carcinoma, the most common form of breast cancer, and immediately began 5 months of chemotherapy, followed by a double mastectomy, a month of radiation, and now hormone therapy.
I definitely wonder if I would have had a mammogram, would they have seen that there was something else there?
According to medical experts, mammography screening below the recommended age guideline of 50 is a complex clinical decision due to potential high risks of false positives, overdiagnosis, and possible unnecessary aggressive treatment that may not lower mortality. Now in recovery, Jana says she's so grateful to be alive and is making her mess her message by starting the #CheckYourself movement, encouraging women to be their own health advocates.
There is nobody that's going to fight for you like you.
And Dr. Jen Ashton is here, and Jana is here in our audience on her 1 year to the day Thrive anniversary, and I see the emotion flooding her face, and we all know it too well. How are you feeling today, Jana? Congratulations.
Thank you. I am feeling amazing. Being here today is such an honor. I followed both of your stories, and it was so influential in my journey, and I want to thank you for sharing it publicly and for women like me and women like me all over this world. Thank you so much.
Thank you.
Thank you.
Allowing us to share your story. Can you imagine, many of us have had a mammogram. Can you imagine doing it live on television? This woman did this. She did this. And everybody thought, I know. And everybody thought, oh, it's just a gimmick. You all are trying to do whatever. you discovered through that mammogram live on television. Later, your doctor followed up with you. What advice do you? First of all, how are you?
Well, first of all, I'm doing great because of you. You nudged me into that mammogram,
okay.
and I appreciate that. And I was doing it for other women, never thinking. So this is my 6th year. Today I had the live mammogram, October 1. So we shared that, right?
Yeah.
But you are, I saw that you were your own health advocate. That's one of the pieces of advice you gave me. And it's such a feeling of strength to give to other women to say, hey, you have to say something isn't right. I'm not going to accept you telling me nothing's wrong. And you have that fight in you. And I hope that your story, and I know it will, inspire so many other women out there who just feel like something isn't right. And their doctors are telling them you're too young. But as you say, age, there's no number.
Doesn't discriminate. Doesn't care what you look like, age, or anything like that. I like to say I'm the class of 2007 and the class of 2012. That's how I phrase it.
Because you obviously had your breast cancer journey. You shared it with the entire world, and then you had this surprise 5 years later.
Right. But I have to say, we don't talk about post-treatment, what happens. And I don't know about you, and we talked about it, and it's really funny, we don't really talk about it that much. We don't. We did in the beginning, but time moves on, but we appreciate this opportunity to do it. But I wish somebody had told me that I would go through depression after treatment.
That's right. Yeah.
No one ever tells you that.
You're so scared.
Yeah, because you're like, okay, you've been watching me all this time, but now you're not watching me any longer. And I remember someone telling me, I wish I could remember who the person was. They said, you're going to wake up one morning and you're going to realize that you've gone days without thinking about it.
And then you told me that too.
Right.
You said, I promise you there will be a day where you won't think about breast cancer.
I know, and I say that to everyone who's going through it. I know it doesn't seem that way now, but you do that.
That's true.
Dr. Jen, help us here because as we've been talking about, bless your heart, that you took initiative, that you knew something wasn't right. But how do we deal with all these different changes and recommendations of what to do and not to do?
I mean, I think first of all, you all have done so much, as Jana said, to increase awareness, to give people hope and inspiration. But the world of cancer is not just about treating the cancer and then sending someone on their way. I mean, it's about treating the whole person, not a body part. And a big part of that is anticipating and helping with the emotional roller coaster that is absolutely not just common, but normal afterwards. You both went through it. I'm sure you did too, Jana, and everyone here. I think it's really important to use a community of support around that. And then the controversy about screening is still there. And I think that's because every time we hear new guidelines, listen for these words. For the average risk woman. Most women are average risk until the day they get that diagnosis. So it's not one size fits all. Everything has to be individualized, and there is a difference between sending someone for a screening mammogram and a diagnostic mammogram.
And how would you encourage people to challenge their doctor if they think...
This is not a dictatorship. So ask questions. You're not insulting your doctor.
I got chills when you said the average risk thing because, as I've said, and I think most people know, I had zero family history. Zero family history. So I was of average risk.
So just ask. You know, a good healthcare provider, a good doctor will never be insulted by a question.
Okay. I don't know if you're going to do this on your 5-year. She climbed Kilimanjaro. And now she's working on next month running a marathon. Anything but average.
Well, I just feel like, I mean, if I do have any advice for you, live like there's no tomorrow. I live like a country music song. That's how I say it. I live like I'm dying.
And thank you all. And please know we recognize that men also go through breast cancer, and we recognize that as well. But thank you for those who have stood by us, those of us who are continuing to be warriors. So proud of each and every one of you, and those that are watching us at home, that we are here for you as well. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.